Is everybody doing tummy tucks about close to the same way?
No, technique is huge here. And in a tummy tuck, and a lot of plastic surgery technique is important. So, Randy, the key to a tummy tuck and doing it well is to get the shaping done properly, which the core foundation of a good tummy tuck is getting that muscle repair done right. And that means you really have to placate those muscles and really get them really tight together so you get that hourglass shape. And that's kind of like the frame of a house, okay? You're building the frame. And there's many different ways that people do this, but I always use very strong sutures that are going to hold it together until it heals, okay? And I like to really pull, as I said, pull that centrally and get that hourglass shaping. And a lot of people won't pull it as tight as I do, but I pull it very tight. The second thing that really shapes it well is very different than most, at least that I learned when I was a resident. When I was a resident, we used to lift all the skin up completely and undermine it all. And I don't do that much anymore. I leave it attached on the side a lot, because when I pull the muscles in, that side skin comes right in, and that's what gives you that hollowing in the side, because that skin is attached right into the muscle and pulling in, and it creates a bit of that midline ab shadow, which, again, after doing thousands of these, you kind of learn how to do it right by playing with it and experience. And so that's what, again, creates that shadowing effect, creates that ab line shadow effect. And the added advantage to it is it also minimizes the loss of blood supply. Because if you lift all that skin up, you've cut off all the blood supply, the whole area of skin. Because we haven't lifted all that skin, we kept it attached, it's still getting tons of blood supply, so it heals better. And that makes the scar thinner, okay? It makes the scar heal better. It takes tension off the incision because the skin is still attached all the way here. It's not all lifted up, so it's not pulling on the scar. It's actually, the scar has very little tension this way. So we get a much better scar, we get much better shaping, much better healing, and usually a faster recovery when we do this kind of tummy tuck. So that's kind of how I do it. It's a little different than...
So when women, in regard to tummy tuck, what are their frequently asked questions? And are there things they're afraid of? Are they worried about scarring?
Yeah, right. So really the two big things that they're mostly afraid of when we do tummy tuck is scarring, number one. That's probably number one. Everyone's worried about, I'm going to have a scar now, okay? And, once they start to see how low the scar is and how thin it looks after a while, most of that fear goes away, because the scar is in trade for all the stretch marks they used to have and all the loose skin. And so when they look at that, they're like, wow, that actually scar is almost impossible to see. So that's one of their biggest fears. The second biggest fear that women have is pain. They hear that tummy tuck's a painful surgery, and they're going to be off work and then downtime, and will people know because they're not there. And so again, the minimizing the downtime and minimizing the pain is critical. And we use pain pumps that actually inject local anesthetic into their abdomen, so they actually have very little to no pain after surgery.
So you'll manage the pain.
Yeah.
So pain should not keep you from doing this.
No, definitely not. It's only a skin and fat surgery, really. We tighten muscles, but we're not going through the muscles, we're not cutting them, and we're not going inside into the abdominal area. So it's actually a very superficial surgery, which actually makes it less painful than a C-section or hysterectomy.
You think, you told me on the phone that the abdomen is one of the most important parts. Everybody looks at your abs, you said.
Yeah, I mean...
After you said that, I was worried about my stomach.
Yeah, well, the abdomen is the center of your body, right? And they're the core muscles. These abdomen muscles are core muscles. So that actually brings up another very interesting thing that we discussed, is that when we do this, not only do these people look better, but they physically feel better and younger. Because now that the abdomen muscles are actually oriented properly, vertically like the way they used to be, they are much stronger. They can contract and have their full strength. They're not pulling on an angle anymore. And that takes the tension off their back muscles, because now before their backs are compensating for the weakness of their abdominal muscles. Now their abdominal muscles are back in gear, taking the force they need to be taking, takes the strain off their back, improves their posture, and a good posture is very sexy. Okay, it makes you look good. I mean, again, if you look at people who work out a lot and they're attractive, partly because their posture is very, very, And again, a tummy tuck fixes that. So
And
women,
that flat stomach, obviously.
yeah, so they feel younger. They feel, you know, they feel stronger in the core, right? They feel they can do many more things, and they are. And so those are, again, added benefits to a tummy tuck that's just so much more than just appearance.